Dr. Fehrman, I would like to talk to you about brushing while having braces, the importance of it, the difficulties of it, because obviously, I've heard that, on one hand you can, you fix your teeth, you straighten them out, they now look beautiful, ready to be falling out because you accumulated the most disastrous thing, which is called gum disease. So tell us a little bit about it, is it am I blowing that out of proportion? Is it very difficult, not so difficult? Is it important? Just tell us all about it.
Well, all right. Well, it's certainly important. I don't think you're blowing it out of proportion. Patients with braces need to brush after every meal and at bedtime. And so that's 4 times a day for most of us. But let's be honest, we all snack. A lot of times we drink things like soda pop, juices. These things are acidic, so that sits on your teeth as well, which can cause problems. So you have to brush after meals and after snacks and after acidic drinks and at bedtime. So lots of brushing goes into wearing braces. Now, is it difficult to do? No. It's a little more difficult than without braces, but there's a technique where you break the front of the tooth into 2 steps, brushing at an angle down above the braces and then back up, and in that way you don't miss any spots. So it is very important. Otherwise, you're exactly right. What good are straight teeth that have scars all over them or holes in them and gum disease? And it certainly happens, but it is totally preventable. And it's not difficult to brush well enough. You just have to change your habits a little bit and make sure you do it.
Mm-hmm. So basically, it's normal brushing. Well, actually not normal. You just said that you basically break it up. So instead of just angling it up towards the gum, you do that, but then you angle it down towards the braces from the top and angle it from towards the braces from the bottom. So, so you have 2 braces instead of 1, I guess, right?
Correct. Is it all right if I just show you quickly?
Yeah, why not?
You come down at an angle above the braces like that.
Yeah, here we go, yeah. A little more to the other side, good, yeah.
Like that, and then come back up this way. So it takes two angles to brush the front, and then you don't miss any spots.
Okay.
And we recommend making small circles with the toothbrush. Don't saw. That's hard on the gums as well.
Mm-hmm. Yeah, lots of dentists keep saying that. And do you have any recommendations in terms of hard brush, soft brush, electric brush, hand brush? Anything there?
Well, I think all dentists nowadays recommend a soft bristled toothbrush, and the reason for that is it's much more gentle on the gum tissue. So I would never use anything but a soft bristled brush, and the studies have shown you do just as well with that, even though it takes a little getting used to. It feels like you're not cleaning, but you are, so just trust it. The mechanical brushes are also very good nowadays. They work great with braces too, but you still have to change your technique and do the 2 angles. As long as you do that, they work great. So I don't have a preference. Whatever the patient wants to use is fine with me, as long as they do the technique correctly.
Right, which is basically up, so that basically when you do it upwards, the way you showed, you go under the braces from the bottom, and at the same time, I guess you go under the gum line on the top. You kind of hit them at the same time, correct. I guess, right? Because the brush is picking up.
Yes, that's correct.
And then down,
that's correct.
You need to go beneath the braces and then down from the top. Okay, so if you do
that, under the archway.
What about the back? And there's some wires in the back also?
Well, there is a technique called lingual orthodontics where everything is on the back. That's really difficult to brush around, but typically in the normal braces setup that I just showed you, there isn't much on the back side. So you brush the biting surface like normal, you brush the inside like normal, but on the outside of the teeth where the braces are actually glued on, you just have to break that into 2 steps.
Yeah. And what about flossing? Because you obviously just can't pull it up because there's the wire in between, right?
Correct. Yes, that's correct. You have to floss once a day, and it's more difficult than without braces, certainly, but we give you little aids to help you. Floss is available nowadays with a stiff end built into it. It's like fishing line almost on the end of a piece of floss, and you can actually thread it through there and get the floss behind the wire. Then you can snap it in and floss. You never snap it back out. You just pull it out gently because you'll snag your braces otherwise. So that's one way. Otherwise, the second way is to just simply poke it straight through from the front. It comes out on the back, and you can floss that way.
And I'm very sure that you indoctrinate the patient on how to do that after he has the braces on, right?
Right. We spend quite a bit of time in the beginning. I do a consult with every patient where I go over it, and then we do it again at the day they get their braces put on. So they've heard it and seen it a couple times, and we show mom as well. So everybody knows how to do it, and it's very important. Otherwise, we wouldn't spend so much time on it.
Well, all right. Now, by the way, should a patient go through his general dentist while having the braces on it still, or not?
Oh, great question. Yes, you do need to keep seeing your general dentist the whole time, because orthodontists are simply doing the tooth movement and adjusting the braces. We do not clean teeth here. So, I mean, if I see an obvious problem, I'll tell you about it, but we're not looking for cavities like your dentist does. We aren't doing a prophy like the dental office does. So you need to keep seeing the dentist. Most orthodontists recommend 3 times a year, where the normal without braces would be twice a year.
Okay. Yeah, because the danger of accumulating plaque because of mistakes in brushing, difficulties in brushing is higher, I suppose. That's why, right?
Right. Exactly. And soda pop is kind of a problem with the teenagers. It doesn't matter if it's regular or diet, it's still very acidic. So you need to brush that off of there, or at the very minimum, swish water after you drink it. So it can totally preventable, but it takes a little effort.
In school, we used to put a penny. Well, anyway, that was in Austria. I don't know what that sucker was made of, but I think it was copper. And we put it in a Coca-Cola, and about 2-3 days later, that thing was gone. And
I know.
So I mean, what are they, I guess the stainless braces or whatever, they're probably a little more durable. They
are, but the teeth get abraded by that, or eroded by that. So.
Yeah. Well, all right. Appreciate your candidness. Very, very informative. Thanks a lot, Dr. Fehrman.
You're welcome.